Think you may have a heel spur? It may actually be plantar fasciitis, or it may be both. Most people assume that when they have heel pain, they have a heel spur. But that's not always true. In this video, I'll explain the differences, why it matters, and what you can do today to start to feel better. Hi, I'm the FIFA doctor, Dr. Shivawali. I practice in Houston, Texas, and if you want to come see me, you can call us at 832-415-1790 or book an appointment on our website down below. I help people walk pain-free every day. Now, heel pain is one of the top reasons that a lot of patients come to see me, and they're confused as to why they even have it. So let's break it down in this video today. What is plantar fasciitis? Plantar fasciitis is an inflammation of the plantar fascial tissue. This is a thick band of ligament that starts in the heel and extends all the way to the toes. It's common in runners, people who have flat feet, or just anyone who spends lots of hours standing or working on their foot. Pain is usually worse in the morning or after sitting down or resting for a while. You go to stand up and that first step in the morning is like, holy moly guacamole, you can barely stand and you have to walk on your tippy toes. That is usually the pathognomonic sign. And you're not gonna see it on x-ray. You may feel on it and it hurts. It's usually on the inside part of your heel and you're just feeling this extreme discomfort. Sometimes it gets better after you've taken a few steps and other times it just never gets better. Now, what is a heel spur? A heel spur is a bony growth at the heel, which is a calcaneus. This is often seen on x-rays. It often forms in response to chronic tension from the attachment side of the plantar fascia. So the plantar fascia goes this way, you would see that the heel spur is forming along the pull of the plantar fascia. Many people have a heel spur, but they don't have any pain because they're not always the cause of a heel spur pain or heel pain. With a heel spur pain, you would start to feel pain with pressure when you're standing or you're walking. It's deep and it's throbbing. That is the difference between plantar fasciitis and the heel spur. So here are the key differences between the plantar fascial pain and the heel spur pain. What's the cause of plantar fasciitis? Inflammation of the plantar fascia. What's the cause of a heel spur pain? Well, the heel spur itself. How about the pain timing? For plantar fasciitis, it is worse in the morning. With heel spur pain, it continually hurts all through the day. How about on x-ray? On x-ray, you can't see plantar fasciitis, but you will be able to see a heel spur on x-ray. Here's the good news. You don't always need surgery for plantar fasciitis, and these are exercises and things that you could do to help your heel pain. You want to make sure that you're stretching the calf and fascia. Make sure you're doing calf stretches, heel raises, and there are lots of videos out there, and I'll post some videos as well. Go through my page, you'll see some videos of how to stretch your calf muscles as well as your plantar fascia to help with heel pain. You do need to wear supportive shoes and orthotics because any shoe that is flat or doesn't give you any kind of support causes the fascia to be stressed. When you're walking, it's super stressed and that causes discomfort. So you need good supportive shoes. You may take over-the-counter anti-inflammatory medications, but please check with your primary care provider or your physician to make sure that that is okay for you. There are topical anti-inflammatory medications as well as oral anti-inflammatory medications. Also, you may ice your foot. Icing helps in two ways. If you freeze a bottle of water, the bottle of water is hard enough to kind of massage that plantar fascia, and the ice helps to cool it and helps with the inflammation. Night splints or stretch splints. These are things that you can get on Amazon, and I'll put links down below that you can use. And ultimately, you want to be able to sleep overnight with them so that the first step in the morning is not extremely painful. But start slow. Start with 5 minutes, 10 minutes. If you start to feel numbness and tingling, then you've been wearing it for a little too long and you need to give yourself a break. But they really help. The more you can stretch your plantar fascia, the more you're going to see a relief in your plantar fascial pain or your heel spur pain. Another option is cortisone injections. Now, you do need to see a doctor for this. So when patient is in severe pain and they've tried everything and it's just not getting better, we do a fluoride-guided injection and that usually helps. Shockwave therapy or pain laser. We do offer shockwave therapy in our office, and what that does is it uses sound waves to transmit signals to our healing cells to come to the area of inflammation and heal the pain. That is an excellent adjunct to treatment of heel pain if you don't want to take medications, but you always have to stretch. Remember, you always have to treat the biomechanical cause. We're not just throwing medicine at you and we're just, having your body heal it. You need to treat the biomechanics. Stretch, stretch, stretch. I cannot stress that enough. And of course, surgery. That is our last resort after we've tried everything. Pain laser, shockwave therapy, injection, ice, medication, massage, physical therapy, boot. Then we can talk about surgery. But again, remember, this is the last resort. Don't just guess what's causing your heel pain. Get expert diagnosis. If you've been limping around for more than 2 weeks, it's absolutely time for it to get checked out. Let me know in the comments, have you had heel pain and what has worked for you? What exercises or what treatment plans have worked for you? If you're new here, this is the Fly Foot Doctor. Would you consider following me? Like this page and like this video and share it with someone that you know may have heel pain who would really like to help them. And thank you for staying till the end. We really appreciate you.